Hi everybody, and welcome to A Case of the Jills. Something slightly different around here. I don't know, there's something missing. This channel is not a beauty channel. However, if you have questions about my hair or why I cut it, I'll be happy to answer those in another video. Today I would like to do an update on my labral hip tear. I have not done a video on YouTube for quite a while, but the emails that I have been getting recently asking me questions about my hip and the labral hip tear that I have compelled me to come back and make a quick video to give you an update and give you some advice. So let me just do a quick review of what I have. About a year ago, I was diagnosed with a labral hip tear on my right side. I also have tendinopathies in the top part of my hamstring as it connects to my butt. And I have a partial tear at the bottom of my abdominals. Yes, it's kind of a mess. So about a year ago, I had the MRI with the injection. You can check out my other videos for what that was all about. I will not lie, that was not fun. I didn't enjoy it at all. I really hated it. I cried all the way through it. It was pathetic. The doctor that I went to suggested that I do physical therapy. And as many of you know, in the middle of all that, I was moving here to Italy, so I had a limited amount of time to do PT. I went to the PT place maybe 4 times before I moved. In that time, I got a lot of good advice about the following things. So from the PT visits, I was able to understand a little bit more about flexibility and understanding what range of motion I had in the joint and what kinds of activities, or I should say, what types of movements would not aggravate or make things worse. I think a lot of the fear I had when I got diagnosed was that anything I was doing was going to be hurting the hip. Anytime I felt pain, I would tense up, which inevitably made things worse because I was just afraid that I was going to be further injuring the joint. So going to the PT was really instrumental in helping me understand my range of motion and understand that I was not going to be doing additional damage. This is about the time when people ask me, due to my extensive running history, do I think that my hip tear was due to overuse? And I really cannot answer that question. No one can answer the question for me personally of where the hip tear came from and why I have it. I've been told repeatedly that labral hip tears can be asymptomatic, which is to say that I could have had this hip tear for years and years and not known about it. I was a soccer player in high school and I played my freshman year in college as well. And I have been told that these sort of lateral kicking movements, like when you kick and it goes across your body, are a way that lots of people get hip tears. Of course, I have no idea if that's true. I don't think any of us do, but I decided not to beat myself up about it and try to understand the origin. I can't go back to yesterday. I can only focus on today and tomorrow. So the second thing that PT really helped me with was to understand where to foam roll. And I know that sounds a little bit strange, but I had a lot of fear again around further injuring either the joint or other parts of my muscles. So I was afraid of where to foam roll. Like, I wasn't sure about foam rolling along my hip. I didn't know if that was going to be problematic or if I was going to be pushing on something, some nerves or whatever that I shouldn't have been pushing on. So the PT was really helpful in letting me understand where exactly it was okay to hit with the foam roller. The other thing that PT helped me understand, for better or for worse, was that dry needling is absolutely not for me. I mean, at all. I jumped about a mile when she tried to put do the dry needling. It was horrible. I think that there's some people who really enjoy it. I did not have good luck with it. When I went to the PT, she gave me a lot of exercises that I could do. One of the problems that I had as an ultra runner was that I was constantly just running, and I didn't really do much strength work. So of course I had weak glutes, I had weak hips, you know, the top part of my glutes was super weak, and of course that also manifested in piriformis issues over the years. So I knew I needed to strengthen those muscles, and she gave me a battery of exercises that I could do. I took video of her doing them and repeated them for much of the time when I first moved here. So let's fast forward. I want to tell you where I am right now. After about 6 months of doing some of the exercises that I got from the Upright Health YouTube channel, I did not buy their full program. However, I did do a lot of the lateral leg lifts and some of the exercises I learned from their YouTube channel. Again, that's Upright Health, and I can link it below. Aside from doing some of those strengtheners, the absolutely 100% most beneficial thing for me was foam rolling. So I started with this one. This is the Trigger Point short foam roller. This is how I started. And I would spend in the beginning anywhere between half an hour to an hour just on this thing on every part of my legs, hips, butt, calves, everything. I just hit everything possible. This was the thing that absolutely stopped the pain, really helped me feel a little bit more like I was doing something that was beneficial. It can be really frustrating when you get this diagnosis because you're like, my God, what can I do? Especially if you're not choosing surgery. So this was something that absolutely helped me so much. Once I progressed from this foam roller, I moved to this one, which is a lot more targeted. It hurts a lot more. Actually, the whole darn thing hurts a lot, and I think that that is just part and parcel of being an athlete for so many years, and you have these knots literally in your muscles that need to be combed out. That's the best way I can describe it. This is also a trigger point product. You can get these on Amazon. One of the most important things, and I'm gonna go through this in 1 second. Actually, let's just go through it right now. This is for your feet. So one of the things I have learned about this process with the labral hip tear injury and also the tendinopathy and piriformis problems, one of the biggest problems is that I have very high arches and very rigid feet. When my feet are tight, it starts to aggravate all of the muscles on my right side. It starts to give me trouble with my hips. It gives me troubles with my piriformis. My hips start screaming if my feet are stiff. So I would stand on this guy. It hurts like hell, but I would get on this thing and roll my feet out, and I swear this was extremely, extremely beneficial. I also want to point out the fact that foot health is so important to me that I actually changed all the kind of footwear that I use. The 3 types of footwear that I absolutely do not wear anymore are high heels, unless it's a special occasion, because I mean, like, come on, I'm a girl, I have to wear high heels sometimes. Thick-soled shoes, so those are your like work boots, Doc Martens, anything with like a thick rubber sole. It may seem like it's comfortable, but it's actually preventing your foot from flexing naturally, and that can exacerbate the pain and increase problems with piriformis and tight muscles. Sorry, my nose is running. So I also had to get rid of flip-flops. I will wear flip-flops into and out of the water at the beach, but that's it. The scrunching motion that my foot has to make in order to keep the flip-flop on absolutely exacerbated my problems. It made all the muscles tight in my feet, which again translates to having all the muscles in my leg tight, making my hip hurt. Okay, so 6 months of leg lifts and foam rolling, and finally was able to hike a little bit more uphill kind of stuff, put a little more pressure, do things that were a little more challenging. In all of this time, I absolutely did not start running. In fact, spoiler alert, I still don't run, and we're gonna talk about that in a minute too, but that is not part of my recovery plan. Also not on my list of possibilities is surgeries, stem cell therapy, injections, supplements, voodoo. I mean, it's just not on my agenda. I have done a lot of research on surgery and whether or not the outcomes are beneficial. So here's the thing. If you ask surgeons, they will say the surgery is extremely successful. And it is successful because they are able to repair the tear. So that is mechanical. They can repair the tear. But that doesn't mean that the surgery is going to be beneficial for you. Meaning, it doesn't necessarily mean that you're going to be pain-free or that you will be able to run again. The outcomes are, they are really varied. So successful, it depends on who you're asking and what their goal is. Another thing that I really want to point out that was very helpful to me, and this is so weird, but I stopped doing yoga. It's the worst thing. I loved yoga so much. I really enjoyed that time. I just really enjoyed the process of doing yoga. Unfortunately, there's so many movements that I had to cut out because they were aggravating my hip that it just became frustrating to me. Now, I'm not saying that that is the case for you or that you should stop yoga. I'm just saying that this is something that I had to do in order to improve the pain that I was having. In its place, and this is really important, I went back to swimming. So now I had all these tendinopathies, right, which is not so different than a tendinitis. They're just, inflammation in the tendons and damage and so forth. For everything, again, that I have researched on this, they don't really respond very well to exercise and strengthening. The tendinopathies, they don't really get better. The only thing you could do is kind of like mitigate the pain and strengthen the muscles around the area. So in order to do that, I went back to swimming. Now, I'm not like a swimmer, like Michael Phelps, I am not. I am a former triathlete, so I triathlon swim, which is to say that I drown forward, like kind of at a pace. Either way, I started ocean swimming again back in May. I transitioned to the pool. It is not because of this, I don't know if you could see it. really big jellyfish that attacked me. It's not because of that, I promise, but I did transition to the pool. P.S. the ocean is a lot easier to swim in than the pool. It has been really beneficial to me to strengthen muscles, to get stronger, your abs, your butt, your legs. I do work with the kickboard and stuff. That has been huge for me. Okay, so what does my current sort of fitness or exercise routine look like? Again, this is what works for me. It may not work for you. You may find more benefit going to the gym or working with a PT or whatever it is. The pain that I'm feeling, and again, I can't speak for everyone, but the pain that I'm feeling is not from the tear necessarily. It's from all the other problems that I have associated with that. So how I get through a week without pain and feeling good and enjoying, most importantly, what I'm doing is the following. I swim in the pool between 2 and 3 times a week, depending. I don't swim for more than about 55 minutes at a time. As I said, I do just like a freestyle, and I do work with the kickboard, and I kind of like old lady swim. So we're not talking like super workout here. I'm not doing drills or anything. I'm just kind of in the pool. Aside from that, I walk a lot. Like I said, I live in Italy, so we don't use a car. I walk to the market, I walk everywhere. So I would say that I probably walk between 2 and 3 miles a day, just getting things done and taking my dog out. On the weekends, we go for a longer hike, and that can be anywhere between 2 and 3 hours, and probably uphill in the beautiful hills here, and it's wonderful, and I'm very lucky because I don't feel pain. I will start to feel pain if I do not stay diligent about rolling out my legs. Being honest, I have to stay on that even now. Not as much as I did at the beginning, but I still have to keep an eye on it. I guess in the end, I know this video was kind of a little bit all over the place. I wanted to address a lot of the questions that I've been getting and also just kind of tell you where I'm at right now. The shift that I have made is more of a philosophical switch than a physical switch. If you watch my channel, you know my history with overtraining syndrome and having recovered from hypothalamic amenorrhea almost 3 years ago now. I'm not a runner anymore, and I don't want to be. I think that adjusting my expectations about what recovery from a labral hip tear was going to be, I had a choice. It was either I bang my head against the wall and try to recapture something that has not been helpful to me physically and mentally, or I transition into something new and enjoy a new adventure and a new way of life and see what it could bring me. I know this sounds like a little Pollyanna, but like I have a very rich experience of being out in the world and walking and seeing beautiful things and hiking and enjoying the meditative time in the pool. And yes, it's different, but it's no less beneficial to me mentally or physically. In fact, I feel better physically now than I have in forever. And mentally, I really feel good. I feel that I can juggle everything, like school, work, being fit or physical or whatever that word is. I don't know. Feeling good in my body. How about that? I think that's a great goal to have, and that's the goal that I had, and I feel that I can achieve that. So no, I don't have the answer of what is the right way to recover or what is the best thing to do. If you have questions or if you want to ask me more about different things, you can email me at caseofthejills@gmail.com. I think if I were to give you any bit of advice on how to deal with the labral hip tear, first of all, give yourself a break. You don't know how it happened, and you may never know, and that's fine. Second of all, do the things you can do. So understand your range of motion, use the foam roller, and try to understand that you don't have to be fearful, but you do want to reduce the pain. Oh, that being said, I don't take NSAIDs or any anti-inflammatories because it hasn't helped me. I would rather do the foam rolling and all that stuff than take a pill. Make sure you watch your footwear. That's super important, especially for women, because we have a tendency of wearing like high heels and raked shoes. But for men too, because I think men have a tendency of wearing thicker soled shoes. And lastly, just try to embrace a new adventure. That's really the only thing we can do. Life changes, and we have to change with it, So anyway, I hope this video was helpful today, and who knows, maybe you might see some more videos from me soon. I hope you're having a great day wherever you are. Thanks for watching.